Are you tired of struggling with respiratory issues and searching for a solution that brings you relief? Look no further than Ipratropium. In this comprehensive guide, we will explore the numerous benefits of Ipratropium and how it can play a vital role in improving your respiratory health. Whether you suffer from asthma, chronic bronchitis, or other respiratory conditions, Ipratropium can provide the much-needed relief you've been longing for. From its ability to open up airways and reduce excessive mucus production to its long-lasting effects, Ipratropium has proven to be a game-changer for those seeking improved respiratory function. But it doesn't stop there. We will also delve into the potential side effects, precautions, and recommended dosage of Ipratropium, ensuring that you have all the information you need to make an informed decision. So, get ready to take control of your respiratory health and discover the incredible benefits of Ipratropium. What is Ipratropium? Ipratropium is a medication that belongs to the class of drugs known as anticholinergics. It is primarily used to treat various respiratory conditions, including asthma, chronic bronchitis, and chronic obstructive pulmonary disease, COPD. Ipratropium works by relaxing the muscles in the airways, which helps to open them up and improve airflow. Unlike some other respiratory medications, Ipratropium does not contain steroids, making it a suitable option for those who may be sensitive to or prefer to avoid steroid medications. How does Ipratropium work? The main mechanism of action of Ipratropium is its ability to block the action of a neurotransmitter called acetylcholine. Acetylcholine is responsible for causing the muscles in the airways to contract, leading to narrowing of the airways and difficulty in breathing. By inhibiting the action of acetylcholine, Ipratropium helps to relax the muscles and widen the airways, allowing for easier breathing. This action also helps to reduce excessive mucus production, further improving respiratory function. Ipratropium is available in various forms, including a nasal spray and an inhalation solution. The nasal spray is commonly used to relieve symptoms of a runny nose caused by allergies or the common cold, while the inhalation solution is used to manage chronic respiratory conditions such as asthma and COPD. The method of administration may vary depending on the specific condition being treated, so it is important to follow the instructions provided by your healthcare provider or pharmacist. Conditions treated with Ipratropium. Ipratropium is commonly used to treat a range of respiratory conditions, including asthma, chronic bronchitis, and COPD. Asthma is a chronic condition characterized by inflammation and constriction of the airways, leading to symptoms such as wheezing, coughing, and shortness of breath. Ipratropium helps to alleviate these symptoms by relaxing the airway muscles and improving airflow. Chronic bronchitis is a type of chronic obstructive pulmonary disease, COPD, characterized by inflammation and excessive mucus production in the bronchial tubes. This can lead to persistent coughing, difficulty breathing, and frequent respiratory infections. Ipratropium helps to reduce mucus production and open up the airways, providing relief from these symptoms and improving overall lung function. In addition to asthma and chronic bronchitis, Ipratropium can also be used in the management of other respiratory conditions, such as emphysema and bronchiectasis. Emphysema is a progressive lung disease that causes damage to the air sacs in the lungs, leading to difficulty in breathing. Bronchiectasis is a condition characterized by the widening and scarring of the airways, resulting in frequent respiratory infections and impaired lung function. Ipratropium can help to alleviate symptoms and improve respiratory function in both of these conditions. Benefits of Ipratropium for respiratory health. The benefits of Ipratropium for respiratory health are numerous and significant. One of the key advantages of Ipratropium is its ability to quickly and effectively open up the airways, providing immediate relief from symptoms such as wheezing, coughing, and shortness of breath. This can be particularly beneficial during an asthma attack or during periods of acute exacerbation in chronic respiratory conditions. Another major benefit of Ipratropium is its ability to reduce excessive mucus production in the airways. Excessive mucus can contribute to airway obstruction and make breathing more difficult. By reducing mucus production, Ipratropium helps to improve airflow and promote better lung function. This can result in a significant improvement in respiratory symptoms and overall quality of life. Ipratropium is also known for its long-lasting effects, providing relief from symptoms for an extended period of time. This means that it does not need to be taken as frequently as some other respiratory medications, reducing the burden of medication management for individuals with chronic respiratory conditions. The convenience of longer-lasting relief can greatly improve adherence to treatment and overall patient satisfaction. In addition to its direct effects on the airways, Ipratropium has also been found to have anti-inflammatory properties. Inflammation is a major factor in many respiratory conditions, including asthma and chronic bronchitis. By reducing inflammation, ipratropium can help to further improve respiratory function and reduce the frequency and severity of symptoms. Ipratropium versus other respiratory medications. When it comes to managing respiratory conditions, there are various medications available, each with its own benefits and considerations. One of the main advantages of ipratropium compared to other respiratory medications is its rapid onset of action. Ipratropium works quickly to open up the airways and provide relief from symptoms, making it a suitable option for acute symptom management. Another advantage of ipratropium is its favorable side effect profile. Compared to some other respiratory medications, ipratropium is generally well tolerated and has a lower risk of systemic side effects. This can be particularly important for individuals who may be more sensitive to the side effects of medications or who have other medical conditions that may be affected by certain medications. In terms of its effectiveness, ipratropium has been shown to be comparable to other respiratory medications in improving lung function and relieving symptoms. However, it is important to note that the choice of medication may vary depending on the specific respiratory condition being treated and individual patient factors. Consulting with a healthcare provider is essential to determine the most appropriate treatment option. Dosage and administration of ipratropium. The dosage and administration of ipratropium may vary depending on the specific form of the medication and the respiratory condition being treated. It is important to follow the instructions provided by your healthcare provider or pharmacist regarding the correct dosage and frequency of administration. For the inhalation solution, the usual recommended dose for adults is 0.5 mg mg to 2.5 mg, administered 3 to 4 times a day. The dose may be adjusted based on individual response and symptom control. It is typically administered using a nebulizer, which converts the medication into a fine mist that can be inhaled. The nasal spray formulation of ipratropium is commonly used to relieve symptoms of a runny nose caused by allergies or the common cold. The usual recommended dose for adults is 2 sprays in each nostril, 2 to 3 times a day. It is important to avoid exceeding the recommended dosage, as this can increase the risk of side effects. Common side effects of ipratropium. While ipratropium is generally well tolerated, like any medication, it can cause side effects in some individuals. Common side effects of ipratropium may include dry mouth, throat irritation, hoarseness, and cough. These side effects are typically mild and transient, resolving on their own without any intervention. Less commonly, ipratropium may cause more severe side effects, such as difficulty breathing, chest tightness, rapid heartbeat, and allergic reactions. If you experience any of these symptoms, it is important to seek immediate medical attention. These side effects could be indicative of a more serious reaction to the medication and should be evaluated by a healthcare professional. Precautions and contraindications for using ipratropium. While ipratropium is generally safe for use, there are certain precautions and contraindications that should be considered. It is important to inform your healthcare provider about any existing medical conditions or allergies you may have before starting treatment with ipratropium. Ipratropium should be used with caution in individuals with a history of narrow-angle glaucoma, urinary retention, or prostatic hypertrophy. The medication may worsen these conditions and should be used under close medical supervision. It is also important to use ipratropium with caution in individuals with a known allergy to atropine or other anticholinergic medications. Allergic reactions to ipratropium are rare but can be serious, so it is important to be aware of any signs of an allergic reaction and seek medical attention if necessary. Frequently asked questions about ipratropium. 1. Can ipratropium be used in children? Ipratropium is generally safe for use in children, but the dosage and administration may vary depending on the age and weight of the child. 1. It is important to consult with a healthcare provider before administering ipratropium to a child. 2. Can ipratropium be used during pregnancy or breastfeeding? The safety of ipratropium during pregnancy and breastfeeding has not been well established. 2. It is important to discuss the potential risks and benefits with a healthcare provider before using ipratropium in these situations. 3. Can ipratropium be used with other respiratory medications? Ipratropium can often be used in combination with other respiratory medications, such as short-acting beta agonists or inhaled corticosteroids, to provide more comprehensive symptom relief. 3. However, the specific combination and dosage should be determined by a healthcare provider. 4. How long does it take for ipratropium to start working? Ipratropium typically starts working within minutes of administration, with the effects lasting for several hours. 4. However, individual response may vary, and it is important to follow the recommended dosage and frequency of administration. 5. Can ipratropium be used as a rescue medication for asthma attacks? Ipratropium can be used as a rescue medication for asthma attacks in combination with a short-acting beta agonist. 5. However, it is important to consult with a healthcare provider for appropriate guidance on the management of asthma attacks. Conclusion: Ipratropium is a highly effective medication for the management of various respiratory conditions. Its ability to open up the airways, reduce excessive mucus production, and provide long-lasting relief makes it a valuable tool in improving respiratory health. With its favorable side effect profile and rapid onset of action, ipratropium is a suitable option for individuals seeking immediate relief from respiratory symptoms. However, it is important to follow the recommended dosage and administration instructions and consult with a healthcare provider for personalized guidance. Take control of your respiratory health and consider the benefits of ipratropium in your treatment plan. Thanks for watching.